So what are the things to be done? See, there are two methods. One is a primary prevention, another is a secondary prevention. Primary prevention of heart disease is in the patients who are having risk factor but no heart attack. There we use the primary prevention. Secondary prevention is those who already have one heart attack, then we give medicine to prevent another heart attack. Okay? So which are the drugs which we give? First and foremost is a lifestyle medication. Lifestyle changes. Okay. Lifestyle changes are, means if he is overweight, we have to encourage them to reduce the weight and get an ideal weight. So weight management is the most important. If person is overweight, then he will have a diabetes, he will have a hypertension and so many other things. So weight management is a good thing. And what do you do for weight management to reduce the weight? I tell my persons that you must take your food from morning 7 to evening 7. 12 hours you take 5 times food and all food should be same quantity. Quality may be different, but quantity should not be much. It should be less quantity. One of the Ayurveda acharyas told me, the heart is of this size, so you should eat the food of this much quantity. And that too 5 times. You don't need more food. Heart and all the diseases today is due to food induced disease. We eat so much of food, that's why there is obesity and that's why there is all the diseases. So first and foremost is you are what you eat. You are what you eat. When you are born, you have taken only mother's milk. For 6 months you take only mother's milk. That was good enough. When you were little, you become like this much, 2 times, 3 times your body, and still you are taking only milk. So milk had everything. Your body can generate what is required. Okay? You don't have to eat fat and protein and amino acid because in chemistry they say, I have to eat calcium, my calcium is low. I have to eat vitamin D, my vitamin D is low. I have to eat vitamin B12 because my B12 is low. No, you eat. You are taking only milk and everything was there in your body. Your body can manufacture vitamin B12, vitamin D, protein, carbohydrate, everything. So you eat less, number one. You eat 5 times in a day. You eat slowly. You eat while sitting, not buffet dinner. Should be avoided. And ideally, I always now try to take between 7 to 7 before sunset. Because anything which you take after sunset, by the time your intestines are so tired, isn't it? And then you get overwork done from them. So whenever you do overwork yourself, you are tired, you know it. Then you don't do that work properly. When you are fresh in the morning, you are energetic, you can do with concentration. So after 7, intestines are tired. So whatever you eat, that become apajya bhojan, means which cannot be digested properly. And then it will be stored in the body as fat. Fat is a storage of calories. Because 1 gram fat gives 9 calories. So whenever you eat anything extra, body doesn't store as a glucose. Because 1 gram glucose will have a 4 calories only. So you convert the glucose into fat and it is being stored in abdominal cavity or in the buttock or below the skin, wherever. And sometimes when it's circulating more in the blood and whenever there is any cracks anywhere in the vessels, that is being stored there in the vessel. So that's why there is a coronary artery disease. So eat less 5 times in a day during 7 to 7 and maintain your body weight. So that's what you have to tell your patient first. Number 1. Number 2, you must have a regular walking, regular exercise. regular physical exercise. Why? Because it will utilize that energy. Okay. So it will prevent accumulation of extra food whichever you have eaten. Plus, your all the vessels will open up. When you do walking regularly, then you get a heart attack, still chances of survival is more. If you get a paralysis, chances of survival is more. Chances of recovery is more. Because you have been physically active, all the vessels are open. So even if there is a by mistake, by chance, by anxiety, because a link is as strong as the weakest link. So you may be strong all the time, but sometime you suddenly get a news, my father died, or then you get a shock. Then, or my wife died, or my children died, or something happened, or you lost so many 20 lakhs in the share market. So suddenly, that is the weakest link in your body, weakest link in your mind, and you get a shock. You raise blood pressure, heart rate goes up, and that is the moment when you get a heart attack or paralysis. So if you have vessels which you have been doing regularly exercise, all the vessels are open. So even if you get a heart attack or paralysis, chances of recovery is faster. Chances of complete recovery is good. So that's why you must walk regularly. So diet, walking, and what to eat in diet. That is important. Okay. According to me, you can eat anything. There is no restriction. But eat less quantity. You eat with peace. You eat with love. Whatever you are going to eat is going to become part of your body. Respect it. Respect it. Because once the moment it goes inside, it is going to become your blood, your bone, your muscles, and they are going to remain with you for many, many years to come. They will be thankful to you because it is becoming your part. You are a living creature on this universe, and so far those food were not that living. There is a energy in that food, and soul is energy. God is energy. Even the food is energy, which but now become of higher status. So eat anything, but this doctors tell don't eat fatty food, isn't it? They say don't eat saturated fat, don't eat this, that. But honestly speaking, I don't believe in all these things. I believe you eat whatever you like. Enjoy eating. But eat with love and respect. Eat less quantity which you can digest. Eat 5 times in a day. Eat small quantity. And eat natural food. Which is natural food? Fruits, vegetables. These are all natural. Man-made food should be trying to avoid. Oil is not in the nature. Oil we have made. Right? You eat sing, you eat chana, you eat badam, kaju, kishmish, everything you eat. You eat all fruits, eat all vegetables. Man-made food should be avoided. We must tell our patients to reduce sugar intake, salt intake, preferably avoid sugar and salt, natural. The sugar comes from the fruits, that is acceptable. Salt is part of each and every vegetable, that is acceptable. Don't add extra salt, don't add extra sugar, and don't add oil, which is a pure fat, isn't it? Then your blood pressure should be remain normal. See, blood pressure cannot be raised. Eat whatever you like. You love your food. Take with peace and respect to the food. That's what I would like to say.
Sure.
I'm not against anything. Only thing that I'm against that excessive salt should not be added. Excessive sugar should not be added. Excessive anything like so much of mirchi. You can't add mirchi powder and add so much. So you eat mirchi yourself, green mirchi. Then you slowly eat it, because that will contain so many things else also. But that red mirchi and there's all those masalas, try to avoid it. Try to take food which is natural. Animal also, naturally you eat it. Don't roast, means so much of oil roasting and so many masalas, avoid that. You can take that. Similarly, they say egg, yellow part of the egg which is full of cholesterol, that should be avoided. So wherever you see exactly so much of fat in that animal, don't eat that part. Protein part of the animal you can eat it. But even I tell my patients to keep their LDL up to 70, and now they come up to 40 or 50 milligram. So lower the LDL, less chances of getting heart attack. That has been our teaching, which we get information from all over the world literature. So we give, if person can keep his cholesterol as low as possible without getting symptoms, is better and safe. Especially those who have high blood pressure, who has a diabetes, who already had a heart attack or had a stroke. So these are the people who already have a disease inside the vessel. And then you must check your cholesterol and try to keep LDL as low as possible. HDL should be as high as possible. So I tell HDL should be 70, LDL also should be 70. In our country, people have low HDL. They have high triglyceride and high LDL. The triglyceride is high, that is also dangerous. So they, once it is, see how it is dangerous, when it is circulating in the body, and there is a disease is there, all anxiety, worry, blood pressure goes up, artery gets damaged, and on that top of cholesterol gets deposited, artery becomes narrow, person become angina or heart attack or paralysis. So this is there. So you must have a regular walking, you must keep a watch on your food, and if you can afford, have a lipid profile and try to keep the LDL low. But then take a drug which does not give you symptoms. You should feel happy with that medicine. If that medicine is giving lot of muscle pain, cramps and other thing, then recheck it and try to keep minimum drugs. But then take it if possible, and then keep the control your cholesterol. Most important is the sugar. Sugar should not be raised. So try to keep sugar as low as possible. Weight should not be raised. Cholesterol, they say it is very important factor. Possibly it is there. We can't deny, because there are a lot of studies they have done and they have found lowering the cholesterol. In Mayo Clinic, they always decide how much is your LDL. The doctor asks each other, mine is 40, mine is 50, mine is 70. They try to keep as low as possible. And newer drugs have come. Atorvastatin, rosuvastatin, these are the two safe drugs now. Earlier the drugs were not that safe, but these are the safe drugs. But then statin taken for a long time, beta blockers taken for a long time can increase the incidence of diabetes. So one has to keep a watch on the sugar. If diabetes comes up, that also is not good. And all people who are diabetes, that means they already have something like one heart attack. A diabetic is a vascular disease. Diabetes is equivalent to already having one heart attack. So all diabetes, we must give statins, means keep the control cholesterol and see that it doesn't get a heart attack.